Have you ever wondered what a junior doctor actually does in a day? I'm talking the specific jobs that they do. Well, if you don't know, and if you don't know, now you know. Let me show you. So junior doctors are often the first people there at the hospital. So they get there before the senior colleagues get in. First thing that you do is you get handover from the night team. And they're the doctors that have been looking after your patients all night. They just give you handover about what's happened, if anything, overnight for your particular patients. So when I was on nights, the main things that I wanted to hand over to the day team were if there's any sick people, and what was done for them. So maybe they had a few emergencies. So at particular hospitals, they might call them MET calls, which stands for a medical emergency, or they might even had a code blue if it's really severe. Sometimes it's just specific things like their blood pressure was a little bit low, their heart rate was a bit high or something. Depends on what. They might have had a fever. The home team just want to know what specific things happened overnight, because that will actually change their plan for that particular patient that day. Now, once we've received handover from the night doctors, the next thing for the junior doctors to do is prepare for the ward round. Now, the ward round is the main thing that we do in the morning, and it's where we go around and see all the patients, check on how they're going, do a couple of exams, and let them know what the plan is for that particular day. Now, depending on your hospital, you might do it slightly different, and especially depending on the unit that you're in. For example, you might be in a hospital that uses a computer-based system. Now, if you have never seen it before, it's pretty funny. They have these computers that are actually on wheels. We used to call them COWs, cows, which would stand for computer on wheels. But there was actually an incident where I think one of the doctors or one of the staff members was referring to that particular computer, which was on wheels, as a cow. And I think a patient thought that they were referring to them. So now we've actually changed them to be called WOWs, working station on wheels. And that's just what we go with now. I think it just avoids any controversy. Where's the cow? The cow's over there. You can see how easily people might be misinterpreting that information. Anyways, if you don't have that, then you either do it on paper and you might print off a list of all the patients, and you just carry around a little pen with you so you can write down all the jobs that you do. So I would always print out a copy of the patient lists, and you've got to print out enough for all the members that are going on that ward round. So there's 5 people. You might have a couple of senior doctors, you might have you and another junior doctor, and then maybe you have a medical student. Print out enough lists for everyone involved. Once the list is prepared, what I would do is start going through and looking at all the numbers for the patients overnight. So even though I've got handover from the night doctors, what I would also do is I want to write down any specific information or numbers that my senior doctors might want to know. So for instance, if someone's got an infection and we're giving them antibiotics, one thing that the doctors might want to know is how many days has the patient been on antibiotics. Another thing that they might want to know is whether the patient had a fever overnight. And I can do that by checking on the observations charts, which looks at all those specific vital signs: the heart rate, the temperature, the respiratory rate, and a whole bunch of other things. If the patient's had a surgery, we want to make sure that their body's now normalized after the operation. We check stuff as their kidney function, their liver function, if they've lost that much blood. So we check a thing called a hemoglobin. Now we check all those parameters are at their patient's baseline that they were before the operation, or approaching it, or as best as they can, depending on how that patient's operation went. So other bits of information that would be important to know is how many days a patient is after a procedure or an operation. Some operations are bigger and cause more strain on the body. So for those, we would expect the patients to take a longer time to recover. But if it's a quick and simple operation and it went very successfully, then we'd expect patients to be up and running sooner. So having an idea of how long the patient's been in hospital and how long after a particular procedure or operation they've had, that's super important information to know and be aware of. But essentially you want all the important bits and pieces at your disposal so you can make decisions about those patients while you're seeing them in person. Now, a special thing that some units might do is they might want a paper round. Now, this is particularly prevalent in the surgical rotations. And a paper round essentially plans out the plans for the patients before you see them. And there's always a degree of flexibility because you might look at the numbers and you might look at their specific situation on paper and say, oh, this patient's suitable to go home. But then you see the patient and maybe their pain is out of control and you need to control that before being able to send them home. Or maybe they have some new shortness of breath or a new symptom, or maybe their wound looks like it's infected. You need to compare the information that you've got on paper or on your system to the actual patient that you've got in front of you. Then you can make a decision about what to do. So the point of the paper round is to give yourself a general direction of where to head with that particular patient. Now, during the ward round, what we do is we go through, present the patient.
Dorian, present your patient.
And work out how they're going. We ask them some questions. We might do a little exam. We might give the patient a chance to ask questions as well, depending on how quickly the ward round is and how busy our day is. After that, this is the most important thing of the morning, and that is the coffee post the ward round. Now, the coffee is an interesting part of the hospital routine, but essentially it's like mandatory.
Now get me some coffee.
It's like common practice almost that the doctors, after they've finished seeing all the patients for the morning on their ward round, that they go to the cafe, get a coffee, have a short break before they get started on the jobs for today. And I think this is one of the most important parts of the day because it sets yourself up with a positive state of mind and also the people around you that are working as part of a team. And if everyone's on the same wavelength, everyone's caffeinated, everyone's like feeling good, then it's just going to be a better day. The next thing that I would do could maybe even be done before we go get coffee, but that is to hand over to the nurse in charge. So the way the hospital works is that there are certain wards scattered all over the hospital. And you might be lucky and all your patients might be in one ward, but sometimes there's patients in different wards. It's just the way the hospital works and how beds are allocated. For each of those different wards, and there's a nurse in charge, and your job as a doctor is to hand over to those nurses in charge so that they're aware of the patient's plan for that day. And this is super important. I learned this really quick, that if your nurse in charge is not on the same page as you, then there can be delays and mismanagement of patients. So one of the biggest tips I have for junior doctors, and especially people starting out, is that you need to get the nurse in charge on side. And the sooner the nurse in charge is aware of what's happening to that patient, the quicker things get done, the better care the patients actually get, and it just works well because now there's like a symbiotic connection. Yeah, let's go with symbiotic. Yeah, there's like synergistic. Synergistic's a better word. There's now a synergistic relationship. Oh, that's nice. Actually feels really good. Yeah, the nurses and the doctors can work on the same page and then everything just works out better. The next thing I want to do after I've updated the nurse in charge is document the notes for the ward round. Depending on what your system is, you might have handwritten notes or you might have typed notes on the computer. Whatever it is, you need to write down a few specific things for the ward round. Who was there, and document what you talked about with the patient. You might have asked them about their symptoms, their pain might be improving or getting better, they might have a new symptom. The next thing you do is you write down any findings on your exam. Maybe the wound that the patient had looked really clean and dry and looked like it was improving. Or maybe they had very limited urine output. Whatever you found on the examination, write that down. The next thing to do is you need to write down the plan. What jobs do you need to do for that particular patient today? It might be you need to refer to a specific unit to get some advice on a particular condition. Maybe their kidney function is going down and you need to get the advice of the renal team who specialize in that area. Maybe they've got a new problem with their heart and you need to get the advice from the cardiology team before proceeding with a new medication. Whatever it is, you need to write down the plan for that particular patient. Now, what we do after we've written the notes is we start doing the jobs. And there's a whole range of jobs that you could do as a doctor. And you need to prioritize them. It can be a bit overwhelming. Depending on how your unit runs, depending on your jobs, you might need to structure them a certain way. But this is how I was taught to structure my jobs. The first thing that people tell you to do is go through the referrals/consults. And that's when you ask another team, another unit for advice. So say if you're working in the general surgery department and you want some advice about the heart, you got to contact the cardiology registrar, the person who's accepting the phone calls or advice calls for that particular day. And if it's very early in the morning, if it's like 8:30 or 9 o'clock, chances are that cardiology team is still going to be on their ward round. So why would you ask advice from them at that time? Maybe wait until like 10 o'clock or so. Sometimes you just got to be aware of what the other teams are doing in the hospital before you start to interrupt their day. If they're busy with other jobs, then what you can also do is you can protocol scans. Now, this might be a foreign concept to some people who don't have to do it at their hospitals, but at our hospital, we have to protocol scans. And what that means is that if we want a particular scan, like a CT scan or an MRI, we need to get that approved by the radiology team. And essentially what you do is it's like a sales pitch almost. You need to convince them that this is the right scan to do for this particular patient. And you just sort of ask the team to do the scan. You might say, "Hi, I'm Harry, I'm from the general surgery team. I'm hoping to protocol a scan. Do you have time?" So then what you do is this. You give them the patient details, you tell them the story, and you tell them why they need the scan done. That's as simple as that. And they might ask you a few questions to clarify the situation, or they might say, probably not. And you'll get better with this over time. It can be quite a daunting thing to try to convince someone who's more senior than you for them to do a scan. But once you understand the reasoning behind the different scans, what you're looking for, and how that's going to change your management, it'll become a walk in the park. After we've sorted out the scans, we can probably look at figuring out the discharge situations for particular patients. So the one thing the nurses in charge want to know from the ward round is which patients are going home and which patients are staying in. So what the nurses do after the ward round is they have their own meeting between the bed manager and other nurses in charge across the hospital. They look at how many people are flagged for discharge and people who are definitely going home. That way the bed manager can start looking at which people can be moved into beds, and it helps with the whole flow of the entire hospital. Your job as a junior doctor is to let the nurse in charge know which people are going home, and then you need to arrange the process. So that includes doing a medication script, making sure the patient has the right medications to go home with. You need to also organize their follow-up plan. Are they going to see a doctor in the clinic? Are they going to see their GP in a week? Do they need to do a particular blood test? Or maybe they need to have an operation in a month. Make sure their plan is organized before they leave the building. The last thing you should do is you do a summary. It's like a discharge summary. And the discharge summary is like a recount of what happened for the patient in hospital. Maybe they had an operation, maybe you started them on a new medication, maybe their kidney function was cooked when they came in, but now it's improved. Whatever happened, just document it and summarize it in a nice, easy to understand format, because this discharge summary will be sent to the patient's GP or family doctor. Other jobs that might need to be done might be procedures. Maybe a patient needs a cannula put in, maybe they need to have a catheter put in, maybe a patient needs to have a sample of their arterial blood. That's called an ABG. It's where you get a needle into the artery instead of the vein. Depending on the type of unit and depending on how senior you are, you might be asked to do a particular procedure. after the ward round. There's probably heaps of other jobs that I've missed, but that's a broad stroke overview of what the jobs that I actually do in my day-to-day. So after we've looked after the jobs for our particular patients, we might need to do some other things around the hospital in the day. And it really depends on the day of the week and the structure of your particular unit. One thing that we might get asked to do is go to the clinic. Now, this is where we see patients who are not staying in hospital. They've come from home or somewhere else to visit hospital for a clinic appointment with the doctor. So what happens is that the bookings team allocates a certain number of patients to a particular clinic day, and then the doctors pick up the patient folders, see the patient, and write a plan. And what clinic is essentially, it's an outpatient arrangement. People from home or outside the hospital come into hospital for a specific appointment with the doctors. You might also want a clinic to plan for an operation. You might want to check their blood test results and go through any results of the pathology that they've got from the operation. For instance, maybe they've had their prostate taken out and you want to go through the actual things that the pathologist found. Do they have cancer or do they not have cancer? These are really important things to go through in the clinic appointments. One of the other things you can do as a junior doctor is, if everything's under control, you could potentially help out with an operation. And that's a really cool thing to be a part of for a junior doctor, because often in surgical units, it's the senior doctors who do all the operating and you need to manage all the administrative-based tasks. Why is that so hard to say? I don't know. Ugh. As a junior doctor in a surgical ward, sometimes you might be caught up with a lot of the admin paper-based tasks. But if you get a chance to go to theatre and help out your senior colleagues, that's an awesome experience. You might be able to scrub in, you might go and watch a case, you might actually help do the case itself. So if you get the chance to go to theatre and help out with the case, then that's an awesome experience, and I highly recommend everyone to do that. There's things that you cannot predict happen in a hospital. These include medical emergencies. There might be a Met call or a code blue, something where the patient deteriorates in their condition and they need urgent care. This obviously takes priority to all the other jobs because the patient's life or condition is at risk. So you need to prioritize that, and you sort of need to drop everything and then do that. Put the band-aids on the situation, fix the situation, and then go back to your other tasks. People have pages on them, and that's essentially that little messaging device that people use to contact you on, and that's additional jobs that you have to do during the day. I do a video on the specific pages I get overnight, so definitely check that out. But some of the specific messages that we might receive on our paging devices might include some nursing staff who might be worried about a particular patient. They might need to clarify the plan from the ward round notes. Or maybe it's about the patient. Maybe the family has just arrived and they want an update on how the patient is going. So you really don't know what's going to go through that paging device. That's just another thing to add to the jobs that you have to do during the day. Something else that we don't consider is that we've got patients who are under our care right now, but there's also new patients that come in. So they might need to be admitted into hospital. I also do a video about how the patient is actually admitted to hospital, and we go through that whole process. So if you want to learn more about that, that'll be in the description as well. But essentially an admission is getting a patient's story, the exam, and the plan, as well as their initial treatment, all sorted so that they can come from the emergency department up to the ward to be looked after under our care. And there's actually a whole bunch of other tasks that come up spontaneously that are not specific task itself, but might just be unique to that situation. And then there's different things that pop up depending on where you are in the hospital. Maybe you need to help out a senior colleague with a specific job. Maybe you need to call the radiology department to try to get your scan done today to advocate for the patient. Maybe there's a blood test that didn't go through and needs to be retaken. You know, all these things happen around the hospital. It's so dynamic and it's always changing, but you learn to adapt to the specific situation. So there you have it. Now you can do my job and I can stay home and then you can go work. That'd be great, actually. Could use a day off. Yeah, hopefully that helps and you understand what a junior doctor now does in a day. Catch you guys next time.